And this is the overlap with mindfulness in a way that we call that metacognitive awareness. So we're becoming aware of our own processes of thinking and judging ourselves. And so mindfulness and cognitive therapy are in that sense very similar, that we are developing in both approaches an awareness of what the mind is actually creating in different assumptions about reality around us.
You have found the Thinking Mind podcast.
Today we're going to be doing a podcast about mindfulness meditation, and I'll be in conversation with Dr. Florian Ruths, who is a consultant psychiatrist and leads a mindfulness-based stress reduction group for doctors. And we'll be talking about how he got into meditation, what are the benefits that he's got from it, and how it's changed his perspective on things, as well as how mindfulness meditation is applied to patients, such as those with anxiety and depression, how mindfulness links with cognitive behaviour therapy, and also some of the cautions that one should apply around mindfulness in certain patient groups. So once again, I hope you find this conversation valuable, and here is Dr. Florian Ruths. I'm very pleased to be here today with Dr. Florian Ruths. Dr. Ruths, thanks very much for coming on the podcast. I wonder if we could get started by perhaps you could explain a little bit about your background and training, and then we can dive a bit deeper into mindfulness.
I think looking back over my life, I probably was always interested in the more intimate emotional experience of human beings. So any conversation that would actually give me a more sort of authentic reflection of what people are actually experiencing, both emotionally and cognitively, and all the doubts and difficulties that they might have experienced in their heads, has always been an interest of mine. I think my conversations with my friends are not that different from my conversation with my patients, in a way that I'm just really wanting to know what's going on for them and wanting to be close to that, and also wanting to fix it. Let's be clear. I think one gets into medicine because we want to help and want to help people change, and always perhaps having sometimes the grandiose delusion that I would be able to fix people by just talking to them, and so I think that's how my career then progressed to sort of immediately then going to psychiatry and noticing that the ward work was rewarding and talking to people was rewarding, but what I really wanted to do is get more into talking to people. And then I had a training session by David Wheel as an SHO, David is now the professor at the Institute and world-renowned expert in CBT for anxiety disorders, particularly body dysmorphic disorders. But he gave me his first session of CBT and explained the basic model. And I remember looking at him and saying, "You must be joking." If you think something in the wrong way, that influences your feelings. And I thought, this is really sort of a very different way of how I imagine psychotherapy to be. But having said that, I then decided, well, this makes a lot of sense, and it's also a nice bit of science behind it. So I started basically doing a training in cognitive behavioral therapy, became at the Institute of Psychiatry course, and then from then onwards, as part of that CBT training, I then got to review a paper by Mark Williams and John Teasdale, which was about mindfulness-based cognitive therapy. So meditation coming in, I thought, what's this? So John Teasdale was teaching on the course himself, and I decided, well, I just need to test that. This is interesting. As evidence, mindfulness meditation works,
So how old were you at this point?
How old was I at that point? That was in 2001. 2001. I was about 36 years old. I then started. I was confined, as I interpreted that day, to go to Maidstone to do old age psychiatry in Maidstone as an SPR for a year. And I thought I was really not very happy with that. I thought, why do I have to go to Maidstone? I did that on my motorcycle. But I used that motorcycle trip to actually do mindfulness meditation on the motorcycle, becoming aware of, the wind and the noises and my visual impressions. And that sort of really got me into meditation. And then I did some training with John Kabat-Zinn in 2003 in Mount Madonna in California. For a week, I met him there delivering his mindfulness-based stress reduction. And then from then onwards, I sort of started delivering MBCT programs at Maudsley with colleagues first and then with patients. So that's a bit of my journey, how I got into mindfulness.
What were your first meditation experiences like?
I think my first meditation experiences probably were really sort of becoming aware what attention actually is. I think attention is something that plays a big role in mindfulness, and we just don't normally actually notice attention. And attention is an automatic process, and sort of the fact that we are actually placing, or we can somehow make choices about where we put our attention, was an intriguing first discovery doing mindfulness on the motorcycle and saying, okay, I'm not going to ruminate. I'm not going to worry about anything. I'm just going to really just attend to the wind blowing over my face, or the sounds of cars overtaking me, or the visual impression when it's raining, or when it's dark, and just really focusing my attention on these kind of different aspects of my sensory experience. And I think that was news to me at that stage. I hadn't sort of noticed that as something that I could do.
Mm-hmm. So I suppose it's a fundamental aspect of mindfulness practice is making the choice to focus your attention on one or another sensory stimulus, and then to notice sort of when you get distracted from doing that, and then to refocus your attention. To someone who might be skeptical about this endeavor, what would you say is the benefit? What is there to find by doing this practice?
Mindfulness meditation is definitely more than just attentional training. So I'd like to sort of expand on that a little bit. So for the skeptic who first thinks about sort of doing or not doing meditation practice, it is literally just sort of familiarizing ourselves with something that opens a whole new door to a different way of being in the world. So initially, when we look at the cost benefit of why I should or should not do this, it's a bit of a leap of faith. Mm-hmm. So the leap of faith would be that I can't promise any outcome. I can't promise that you will find anything. I can only promise that if you do it on a regular basis, you will somehow, the benefits will emerge. So I would probably like to compare it to sort of getting somebody who hasn't exercised for a decade to say, well, I think it's good for you to exercise, because you might argue the person that hasn't exercised for the last decade might say, well, I've got little twinges here and there, but overall I'm okay. Why should I exercise? Mm-hmm. And so it's sort of several aspects to it. It takes a bit of a leap of faith with regards to saying, I think this is worth doing. And you need to just do it in order to find it for yourself, to experience for yourself.
Yeah.
The other aspect is obviously sort of presenting the person with a rationale why it's worth doing. And that's obviously a whole new sort of different area where you can obviously sort of really then display all the evidence of the benefit of mindfulness. Mm-hmm. But you're right. I think in a way it is a bit of both.
What have you found the benefits been for yourself personally?
It's a very interesting question, because I ask myself sometimes if I see myself as a randomized controlled trial, sliding door scenario. So the sliding door one scenario, I decided mindfulness is a lot of rubbish. I will not do it. And then I follow my life then, versus I decided mindfulness is something that is meaningful in my life, and I will engage with it on a regular basis. I wouldn't necessarily know where I would have been with the first scenario.
Yeah, you don't know the counterfactual.
Exactly. So we've only got one way of sort of experiencing ourselves and the whole process. What I have found is, when I compare myself to a lot of people around me, we all go through sort of adversity. We all go through difficulties. We go through difficulties at work. We go through difficulties with our health. We go through difficulties in our relationships with others. And so the life throws these challenges at us. And so we then look at ourselves and see how we're coping with this. And, without going into too many details, I think I've had a fair share of that. And, I look at myself and I think, well, I've come out all right, sort of survived. And, one wonders how one does that. Is that genetic? Is it just our personality? Is it our sort of temperament? Or is it something that we've done right? And I sometimes like to basically convince myself that I've done something right by meditating. But I wouldn't know how I'd been without it. So I convinced myself that the evidence that we have about the influence of meditation, I've experienced that myself. So all the resilience building that we can see from the studies might have actually sort of shown itself somehow.
So it's something to do with the relationship with adversity, which, of course, if you look at Buddhism, from which mindfulness meditation derives, some of the primary tenets of that philosophy is that life is characterized by suffering, that suffering is omnipresent, and anyone that's lived is aware of that, and that through some kind of introspective practice, be it meditation or be it therapy or be it whatever, these practices allow one to develop a different relationship with adversity, because you can't really get rid of adversity, and there's only a certain extent to which one can overcome it. One has to find a new way of being in relationship to uncertainty, in relationship to the fact that, to some degree, life is tragic for everyone. Talking a bit more about the research that's been done about mindfulness, what do you think are the more salient points to be found there?
I went to a talk recently, a couple of years ago, where a professor from America was talking about how many studies it took to convince us that exercise is good for us. And she said it took roughly about 100,000 studies to really sort of confirm that exercise is actually beneficial for our health. And so we are now sort of probably at the realm of 12 to 15,000 studies of studies being published in the world literature showing that mindfulness in some shape or form has got beneficial effects. So we're still far away from the exercise literature. So this is just to put the wider context of where we are. How many studies does it take us to convince that something is beneficial is a really, really sort of big philosophical issue. I think what I'd like to highlight in the literature is that sort of obviously the big meta-analysis that we've got. So if we look at the highest level of exercise and the meta-analysis, do show consistently that there is a significantly and a measurable benefit for mental well-being. So we've got sort of an overall sort of psychological well-being measure. We've got anxiety measures that can see that overall mindfulness reduces anxiety. Mindfulness sort of contributes to us being sort of generally sort of perhaps better in our relationships with others. So that becomes more relevant to the health professionals. And so we can sort of then kind of divide this research into, do we do with certain groups? So we look at sort of patient-based, we can see benefits, but then you can also look at professional groups. So, for example, there's a good meta-analysis, smaller though, that also show it works for professionals and health professionals. So I think, we are sort of collecting a lot of evidence sort of at a higher level, and then we can go into smaller level cohort studies, randomized controlled sort of cohorts that we follow without sort of blinding the interventions, etc. So these are the levels of evidence that we've got that are quite compelling. And I think we can't ignore them.
Yeah, and I think the analogy to physical training is very appropriate. And it's probably important to point out that physical training has only been popular for 50, 60, 70 years. And before that, it was considered just as esoteric as meditation is considered today. And the idea that most people don't engage in any kind of mental training when fundamentally everything that we experience in the world is experienced through the lens of our mind, and that we would make no effort to train our attention, but then do all of the other things that mindfulness involves, it's crazy to think about, actually. And yeah, I think it's important, obviously, that research is carried out, and you want you want to have some sort of formal scientific inquiry into anything, particularly when you're advising that people adopt it on a mass scale. At the same time, for every kind of individual, life involves doing your own series of n=1 experiments and finding out what it is that works for you, whether it's, how you eat or how you exercise or how you train your mind or how you engage in relationships. Like you said, you do, even with something very straightforward and unexotic, like embarking on a career, you must take that leap of faith. There is no, just like you said, there's no guarantee with meditation. Similarly, there's no guarantee with any choice that you make, and you never really know what would happen if you had chosen differently. I think sometimes I wonder what it is that people find, because I myself probably was quite skeptical about meditation. Just so sort of listeners are aware, I would consider myself an advanced beginner at this point. I've done maybe 100 hours of personal meditation, and so I'm still very much at the start. But I started from a very skeptical point of view. I don't mean skeptical with the kind of capital S. I mean that I was very willing to try it and see what benefits it accrued, if any. And I did it for something like 10 days and then started to find that I had interesting experiences and that it gave me more of a bird's eye view on my mind, my thoughts, my emotions, and that the more I did, the more that happened. I'm curious about going more intensely, doing things like silent retreat. Have you ever been on a silent retreat?
So, sort of silent retreats are very special experiences because they're countercultural experiences, because we do the exact opposite of what we would normally do, and normally would try to stimulate ourselves to the best of our abilities with regards to visual and auditory influences. And when you go on a silent retreat, as the name says, we're actually sort of literally shutting down our senses, our visual and our auditory senses, and perhaps making other senses more present to us. So our smells and our taste buds and our sort of just perhaps also our ability to be with ourselves. A silent retreat means that we're not encouraged to talk to each other. So we're with 60 other people that we don't necessarily know. We share a smaller space, but we're not necessarily encouraged to interact with each other in a way that we're not talking to each other because it's silent. And that is very counterintuitive and counter-human almost. Sort of, we normally like to talk to each other, and we're very sociable animals who always want to hang out with other animals. So to be with others in a space where we're not talking to each other is a very new experience, and we're thrown back to just experiencing ourselves. We're not encouraged to read. We're not encouraged to listen to any sort of podcasts or anything. We're not encouraged to use our phones. So it's a very sort of going back to really sort of listening back into yourself. And then I think that in itself offers a lot of sort of interesting experiences with regards to what comes up.
Mm-hmm. Typically, from what I've heard, people might find the first few days of adjustment very difficult, and they find that their mind's tendency to want stimulation to be very overpowering and overwhelming. But then maybe around 3 days in, all of a sudden things become more peaceful and blissful. Is that more or less analogous to your experience?
It's very similar to my experience in a way that the first 3 or 4 days are often around sort of your mind throwing up a lot of old visitors. Sometimes the teachers like to say, "Oh, the mind's going to the museum." We go over our past, we go over our past relationships, our past friendships, perhaps sort of telling ourselves off or perhaps making a few mistakes on the way. and all the emotional experiences associated with that. And then eventually, sort of, that's my personal experience, I can't speak for anybody else, the mind seems to be sort of settling a little bit. I mean, Willem Kuyken, who's the director of the Oxford Mindfulness Centre, he likes to bring a sort of a glass of water with a jug of water with some sand in it, and he shakes it, and then the sand stirs around the water, and eventually after a while the sand settles again, and then the water becomes clear again. And I think that's the best metaphor he finds, and I agree with him, to explain what happens with the mind. The dust seems to settle a little bit, and a clarity arises, which is very unusual to explain, or very difficult to explain what that actually feels like. The only thing I can say is I would invite people to experience it and see what happens as things just calm down. It's almost like a rebooting of the hardware. It's a very lovely experience to perhaps calm down, also kind of noticing how little we need. We need good food, we need a bit of warmth around us with regards to heating, and some people that are not threatening towards us, around us, to protect us. And things are really good. We don't need a lot of stuff that we think we normally need.
Do you think people are having that experience now during the times of coronavirus, quarantine, isolation? We almost, if you think about it, we almost live in a society that's anti-silent retreat in its design, in terms of we very much live in a system that encourages stimulation, addition, growth, adding more, not subtracting. And now obviously we're in a different situation where people have a lot of things that are being taken away from their lives. And I wonder, do you think that now people have more of an opportunity to have that quiet reflection and to see what it is, like you mentioned, how little we actually need to be content?
That's a wonderful question, Alex, and I think about it all the time. I was asked recently, just yesterday, actually, what's the positive about the COVID crisis and the lockdown? And I thought, well, there's one thing I can think of is it's sort of almost like a world retreat. We're all on a retreat now for not very good reason, because we are cursed. We're not invited. We've just been cursed to do this, and that will cause resistance within ourselves. But there is, so we're not doing it for very good reasons. Let's put it this way.
Well, I suppose you could say it's not very good reasons. At the same time, again, if you go back to the historical origins of these practices, one of the fundamental drivers was the unforgiving aspects of life, the tragic and suffering-laden aspects of life, which drove people to engage in these contemplative practices. So obviously, while I think the tragedy of coronavirus and COVID can't be understated, it makes sense that this would be a driver for a kind of global period of reflection. I think maybe it has always been tragedy which spares our sort of deepest insights.
So let me just break that down a little bit. The monastic tradition behind mindfulness is never been there for us to almost sort of encourage us to be all monastics. Okay, so the monastic tradition has always sort of been a sort of I would basically sort of conceptualize it as a bit of a lab to test technology in a very intensive way. And that's how I see it going on a retreat. And I will hopefully bridge it over to what's happening now. So the retreat is not encouraging us to all live as monastics, or to say that we should all be monks and withdraw from the world. The retreat is an opportunity to train and to help us develop and cultivate a tool that makes us able to go out into life and live life in a slightly different way, and be immersed in life, and be immersed in what you call the suffering, of life. And as doctors and as mental health professionals and health professionals, we are obviously very close to that. And we need a tool in order to help us immerse ourselves. So mindfulness is never an encouragement to avoid what's going on out there in the world. It's the opposite. It's mindfulness is something about going into the difficulties and the suffering and perhaps also the pain that people are going through, and to deal with it in a different way. So in that sense, when we think about what's happening now in the world, we are being shut down in a way that, and I find it fascinating, there is just no narrative happening anymore. When we watch the news, it's like Groundhog Day.
What do you mean by that?
Well, it's interesting because we are a narrative species. We like to talk to each other. We like to sort of tell each other stories. And, the biggest thing I'm missing is football. Because football is the biggest story of our lives, where we can just endlessly talk about, the different aspects of it and sort of have a playful and a gay, sort of real play around sort of a storytelling that's infinite. And now suddenly we don't have that. There's no gossip because nobody's doing anything. So we are.
So you mean it's replaced all our narratives?
Our narratives have just shrunk, and that throws us back at our own narrative, I think. And that's why I think there is a beneficial, if we see any benefits, there's an opportunity for us to perhaps also be thrown back at our own narrative and perhaps also reflecting a little bit about, without the action, the distraction that we normally have, to basically what's going on for us. So there is an opportunity to really explore mindfulness and mindful awareness in the lockdown. And as you may know, we are actually providing daily mindfulness practices through South London Maudsley websites, simply to encourage and invite people to perhaps use that time to connect to suffering and connect to the suffering out there that we all know about, in a slightly different way, but also perhaps finding out how we respond to that, what's going on with us.
I think the point you mentioned is very important, that it's very easy to get the sense from mindfulness practice and from things like retreat that it might be about withdrawing from life, but actually it's very much the opposite. It's developing a different but very active relationship with the world around you. Often it's about helping develop a code of ethics as well, and really trying to get the most meaning and well-being from life, rather than from trying to insulate yourselves from life. So I'm curious about how things will look for people once we're on the other side of this pandemic, and what sort of lessons people will learn from it. We haven't really had such a widespread we haven't had a generational crisis since probably the Cold War or World War II. What does your daily practice look like at the moment?
My daily sort of life practice or mindfulness practice?
Your daily mindfulness practice.
Well, I'm really very sort of working from home, so I've got a bit of flexibility with regards to structuring my day. I do start, Monday to Friday, to feel myself connected to my colleagues by helping to set up a daily meditation practice for them. That also helps me structure my day. And then I normally do my own mindfulness meditation practice, which I really, really enjoy, because in the business of life, sometimes I don't necessarily do it at home. I do my mindfulness practice, on my travel to work or sometimes at work, and much shorter than I'm able to do it now. So that's lovely. I've built a new relationship with my very neglected garden, where I sometimes like to sit and meditate. It is not only mindfulness practice is not only about sitting down and sitting in a lotus posture and focusing on your breath. You can take mindfulness into any kind of activity that we do. It's just sort of paying attention in a slightly different way to what we're actually doing in the moment.
Mm-hmm. Can you elaborate a bit on that? So can you expand a bit more on what it means to pay attention in a mindful way?
So we distinguish between the more formal practices, where we basically just sit for half an hour, 3/4 of an hour, and start kind of going through different aspects of our attention. So we attend to the breath first, and then we attend to the body, then we attend to our sort of hearing, what we're hearing sort of around us, sounds around us, and then we attend to our internal experiences, including our imagery, our thoughts, and our feelings, and we're sort of making these objects of our attention. And that helps us cultivate attentional sort of energies, if that makes sense, and among other things. But we can also experience attention to anything that's happening in the present moment. That might be making a cup of tea. So, attending to how we all open the tap and basically just fill a jug with water, and then sort of starting boiling the water and then putting the tea bag into the water can also be a present moment experience. And just noticing what happens with our body as we do this. How does this feel with our body? So really putting our mind's energy not into necessarily thinking about the next day or worrying about what's going to happen with the economy or worrying about perhaps getting infected ourselves, but really deliberately saying, well, now I'm just attending to making a cup of tea. So we can literally use present moment awareness and sort of becoming aware of what's going on in the present moment through anything we do in life. So, and as life is perhaps tiny less busy and perhaps also sort of afflicted by a lot of intensive emotions and stress and perhaps even anxieties, we can pay more attention to these kind of little things that we do in life.
Yeah, what I've found is that one of the biggest gains from the practice is simply becoming more aware of how the vast majority of the time one is completely lost in thought, usually either about something in the past or in the future. And being lost in thought like that completely distorts whatever your present experience happens to be. I mean, you could be on a beach in Thailand, and if you're lost in thought about the past or the future, you might as well not be there. You might as well be somewhere else entirely. And so I found the benefit of just seeing what your kind of operating system looks like most of the time, and then slowly giving you the attentional tool which you described to pierce through that, and you get these brief moments above the clouds where you can realize actually what's possible and how it's possible to feel when you're not constantly ruminating. It's just so tremendously beneficial.
Yeah, I mean, basically what you're saying is very, very, very important and very meaningful. Where were you when you were on a beach in Thailand? Where were you when you were living your life? And it's very easy to basically miss our lives by basically constantly being somewhere else when we actually are. And that's okay. So I like to say that sometimes. Being human, we've got, in comparison to my cat and to our dogs that people might have, we've got as a species a very amazing capacity. We've got a brain that can simulate other time planes. We've got a brain that can simulate the future, so it can create a sort of simulation of the future, and we've got a brain that can simulate or re-simulate the past. Now, from a sort of evolutionary point of view, that was the Big Bang. Our capacity to do that. So not only are we in the present moment, oh God, I'm hungry now, how can I get food? But we can really simulate what's going to happen next year. I'm going to make a plan for next year's food vision, and also learn from last year when the harvest wasn't going well. Some animals came in there and they ate half of our food. How can we prevent that next year? So we've got this wonderful capacity. And it makes us deeply human and very sort of, and if we're good at it, like lots of doctors, that I work with in my mindfulness program with doctors, they're extremely good at planning out the future of their patients. I can see you ill now, but I have got an idea of how we could get you back to where you were before. That's called curing or therapy. So I'm planning out that for you. Mm-hmm. Or I want to go back and really understand how you became ill in this way so I can prevent it from happening again. So our capacity to do that is marvelous. It's fantastic. And it makes us, as professionals and as human beings, we've got wonderful abilities to do that. Now, there is a problem with that. And the problem is if we don't stop doing it sometimes. So if we take our work home and basically say we've seen our patients, and then we think about the patients that we saw, when we're at home, we're actually missing out on experiencing relaxation. So our mind, for all its qualities and its wonderful capacities, takes us out of the time plane where we are involuntarily. So we're actually not making a choice about doing it. It automatically does it. So we overuse the capacity of our mind to basically simulate the past and simulate the future. And so this is where mindfulness comes in and saying, hang on, this is great that you can do that, but can we also sometimes just be with what's happening in the present moment rather than needing to simulate past and future all the time?
And the most insidious aspect of it is that we're not even overusing our minds, because thought most of the time, as you discover through a mindfulness practice, isn't even a voluntary action. Most of the time, thoughts spontaneously appear in our consciousness, as do emotions. And that's just happening on a loop over and over again. How many times have you wanted to pay attention to something, actively tried, but it's a struggle, it's an upstream struggle, because try as you might, your mind is constantly producing this stream of distractions. So it's not even that we're choosing to engage in thought because we're, workaholics or something, and then now we have a choice. It's that the default state of the mind appears to be this deluge of distraction, and we're not even aware that that's the case often until we start some sort of introspective practice. I think, again, therapy is interesting to mention, because I think although therapy and meditation aren't the same thing, they work quite well in parallel. How have you found mindfulness to work with cognitive behavioral therapy? Maybe you can explain a little bit what cognitive behavioral therapy is initially.
So cognitive behavioral therapy is sort of a techniques that we've developed over the last, since the early 70s perhaps, where we look much more closely at how we can influence our emotional being through the way we perceive or see the world in thoughts. So that's the initial sort of cognition, being a thought or belief, a value system. How does that influence our belief system and what we think on a moment-to-moment basis? How does that influence how we feel? And so when we sort of, to give an example, if I thought, oh God, everybody hates me, when I actually am on a live stream or on a stream of on an audio stream, then I might actually be quite anxious in basically being part of an interview. So if that becomes the dominant thought, then that might influence my emotions in a very sort of significant way. And so we've become aware of that connection, and there's lots and lots of evidence from labs that show that connection, that our words and the way we think about ourselves is very much influenced on how we feel about ourselves. And to a large degree, our mind just gets it wrong. Our mind is just providing us with a lot of very distorted facts about ourselves. So we know that minds just throw up a lot of different options of what is happening in the present moment, and we just choose randomly what option we go for, and often it's a very distorted view of the reality. So what we're doing in cognitive therapy is sort of developing a fairer view of what's actually going on in the present moment. So we're thinking that you've got a belief, you're flawed, the belief is I'm flawed, and everybody knows it. And we start looking at cognitive therapy in a rather sort of experimental way. How accurate is that actually? What evidence do you have for that? That A, the belief is true, I'm flawed, and B, that everybody knows it. And people find that it's actually not the truth about themselves. They're often really, really, most people are good people, and most people are trying really hard, and other people also notice.
Yeah, and the other thing is that people are normally concerned with themselves rather than with other people. So when often people have an idea that everyone's judging them, thinking about them, making negative judgments about them. Actually, typically, the people they're interacting with are just as self-concerned as they are.
Absolutely. So it's often that we think people are judging us, but actually we were, as you say, we're often much more absorbed about how we judge ourselves. So this is sort of something that we learn in cognitive therapy, and it's obviously trying to really, really make it sort of explain it in simple terms. And so we know that we're developing a different relationship with our thinking process in cognitive therapy. So we're basically finding out our thoughts are not our facts about ourselves. Thoughts are just alternatives, simulations, as some people like to call it, about what could be the truth. And this is the overlap with mindfulness in a way that we call that metacognitive awareness. So we're becoming aware of our own processes of thinking and judging ourselves. And so mindfulness and cognitive therapy are in that sense very similar, that we are developing in both approaches an awareness of what the mind is actually creating in different assumptions about reality around us. So in meditation, we're realizing, oh God, my thought is really, I'm really critical towards myself because I said something I think people might misconstrue, and why did I say that? Why did I not say it in a different way? Oh God, that's all a lot of rubbish. Everybody thinks that I'm rubbish. So we notice our minds sort of going through these hypotheses, and we develop a metacognitive awareness of that, both through cognitive therapy and through mindfulness meditation, that this is probably just another thought I've had. It's not necessarily the truth about myself, and can I just step back a little bit and develop, and this is a really important aspect we haven't talked about, develop a friendly and a fairer way of looking at myself as a human being, and sort of really looking at fairness. So all we wanted to achieve is not positive thinking, so we're all great, we're all marvelous, and we're all fantastic, but it's about a fairer view of ourselves, perhaps a more objective view of ourselves. We're okay, and we're trying our best, and sometimes we fail, and sometimes we get it right, and sometimes we need to start again. So that we're developing a softer and a fairer view of what's actually the reality about ourselves actually is. And so, in that sense, mindfulness and cognitive therapy are overlapping, and we are now using that overlap in order to give people a tool to develop that more friendly and slightly, not detached is the wrong expression, but perhaps a bit more an overview of our mental experience in a slightly different way. And that's how we use it for our patients in relapse prevention of depression.
And there's an emphasis at times on compassion, that one can learn to treat oneself in a more compassionate way, as though one might treat a friend, because often we treat others with more fairness, as you mentioned, than we actually treat ourselves. Is it fair to say then that CBT kind of gives you the theoretical framework and mindfulness meditation is the experiential side, and so they're working together towards a common end?
I would say there's slightly sort of different ways of getting to the same point. Okay, so CBT is very change orientated. In a way that we're really sort of basically looking at thought. This is a distorted thought, is that it's not a fair thought about yourself. Can we change it? So it's a very content change sort of orientated approach, very much along the line with what we do in medicine. I mean, medicine is all about change. You're ill now, I want you to be well. While in mindfulness, we're cultivating much more a spirit of non-change, which is paradoxical. Yeah, and we call that sort of more observation of what actually is going on, rather than sort of needing to change it immediately. So actually just checking that, so what is actually going on, and sort of what is the reality? What is my reality actually right now, rather than thinking about changing anything. So in that sense, it's a slightly softer approach than CBT. So CBT, very much like most other things we do in medicine and psychology, is about sort of changing things, while mindfulness is much more about observing things as they are, and then change may emerge or may not. So that's the sort of the choice point then arises more naturally. Oh, this is something. My back is hurting as I sit here on my chair or on my cushion. I can now decide to change my posture and see what happens to my back. But the change arises more of a softer sort of choice that we make out of just finding out what is actually happening. And what we often find is that what is actually happening is nowhere near what we think is happening. And so we're learning to distinguish between thoughts are not necessarily our reality. Our reality is often something that is something that we can connect to in a slightly different way.
Mm-hmm. That's a very good point. So that idea of allowing things to emerge as they will without that focus of control, I think, is very freeing for a lot of us, and very freeing for people who do experience problems with anxiety and depression, because often those problems emerge from an excess of control or an excess desire for control, psychologically speaking. And this is a completely different paradigm where you're giving yourself a break, essentially, and giving yourself the freedom to step back. What are the situations where you think mindfulness should not be recommended or is not the most helpful approach?
Mindfulness is a very broad term, and so I would like to sort of make a little sort of distinction between meditation versus mindfulness. Meditation is, if we use a sports metaphor, meditation is sort of the running exercise, while mindfulness is more compared to a sort of fitness, cardiovascular fitness metaphor. So if we can see the two as slightly different, meditation in itself is a very intensive experience, very, very emotionally sort of relevant experience. And we know that it can have certain unusual or unexpected effects, where people, for example, people with health anxiety have got an exquisite capacity to focus on their bodies. In fact, they're doing nothing else but focusing on their bodies. And so when you fear that you might have suffering from an illness, all you're doing constantly is checking in with your body and, oh God, is there pain now? Have I developed an illness now? God, is there something happening in my body? So for example, people with health anxiety, as an example, may have a too strong attention on their bodies. So when we're doing attention to the body and other people, we notice that they don't notice their bodies at all. We're often quite cut off from our bodies. So in order to then find the right meditation for the right person, we may find that if we ask somebody with health anxiety to focus on their body more, they're freaking out because they've already been focused on their body so much. It actually makes them worse. So in that sense, we're learning to adapt any kind of mindfulness practice, any kind of meditation practice to what this individual needs. And that's where the softness and the friendliness comes in. And really always dropping in the question, whatever meditation practice we need, how friendly am I doing this? By doing this to me? We have got a huge amount of people that are extremely self-critical. And they use meditation as just another stick to beat ourselves up with. And so they're sitting doing their meditation and saying, God, I can't concentrate. My mind's going off. My body is restless. I want to get up. I'm asked here to do meditation. I'm just rubbish at meditating. Now, so this is sort of then when we really say, meditation also needs to be always an experience of friendliness. We're not here to just sort of torture you. We're here to sort of really bring in how can we cultivate friendliness, together. And for these people, it might actually be useful to not do a sitting meditation, but perhaps a walking meditation. We're going for a walk and just noting their body in movement, so that they don't sort of are not overwhelmed by these negative thoughts, throwing sort of just more criticism at them. So that's why meditation needs to be guided by experienced teachers. That's why it needs to be guided by people that really understand meditation from the within. Not anybody who's listened to meditation and memorized the meditation practice can guide other people, because it takes a bit of skill to really understand what friendly ethos is and how we can translate it for each individual. So in that sense, any badly guided meditation can be actually unhelpful and can be potentially have side effects like any bad exercise can have side effects. Exercise, as much as we know it's good for you, if you do it in the wrong way, oh my God, I've injured myself badly in the gym.
So have I.
Yeah, people die on their cycles, when they're not wearing helmets. So there's no good or bad tool. There's just a skillful application of a tool, and then there's an unskillful application of a tool. So that's why I'm sort of really inviting people to think about skillful mindful meditation and skillful mindfulness rather than, just not being guided in a very well way and then sort of doing more harshness to yourself, doing more harm to yourself.
So it's important to recognize that even though from the outside it looks like sitting down with your eyes closed, actually it's a very powerful intervention and can have very powerful psychological effects. And so it's very important to treat everyone that's doing it as an individual, to have experienced teacher, as you said. Are there any particular psychiatric conditions? You mentioned health anxiety. Are there any other psychiatric conditions where you would be particularly cautious?
There's obviously a lot of literature, mindfulness, like so many things in what we do in psychiatry. Everything that works for one condition, we use it for another condition. We used antipsychotics for psychotic experience 50 years ago, and then we use it for depression, and then we use it for ADHD, and then we use it for dementia, and we use everything for everything because we think we might get a benefit out of it. And so mindfulness has been used for almost all mental health conditions. And there are trials out there, and there's modifications of mindfulness. So I'm not saying this in a critical way. I'm saying this in a rather admiring way, that we're obviously trying to see if tools work and can be adapted for all sorts of conditions. I'm a psychiatrist who's also done community psychiatry. I've had a group of very, very psychotic people on the way. Paul Chadwick, for example, has done a lot of work with mindfulness for psychosis. And yet again, I think it needs to be really sort of adapted when people are having hallucinatory experiences, to develop a relationship with these hallucinations in a slightly perhaps sort of distancing way, through perhaps using short meditation practices might be a way where some emotional change can achieve. We've seen people using mindfulness in PTSD, and when you're in the acute phase of PTSD, where you've got very, 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 very emotionally charged intrusions coming in form of flashbacks or sort of almost pseudo hallucinations, it can be unbelievably sort of difficult for these people to meditate, and probably not doing them much good. So yet again, we need to think about modification, different types of meditation that there is. There's walking meditation, sitting meditation, standing meditation, listening meditation. There's lots of different forms of what do we use as the object of our meditation. And I think that's why skillful reflection, but also skeptical reflection, skepticism that you mentioned at the beginning, is actually useful. We don't want to do harm, and we don't want to think that, that if we teach a tool that works for us, it's not a panacea. It needs to be used in a skillful way.
Mm-hmm. That makes a lot of sense. So bearing in mind the individual that you have in front of you, whatever comorbidities they may have, and experienced teachers who can modify the guidance appropriately. If we can get a bit more esoteric into different kinds of practice, have you paid much attention to the distinction between a kind of dualistic practice where one has a kind of subject-object relationship, and a more non-dualistic awareness where the practice is more about punching through the sense of having a self and having a more, we're probably going to lose a lot of listeners at this point, but having a more deconstructed idea of one's consciousness?
Perhaps elaborate slightly more on the deconstructed versus sort of dualistic sort of version of things.
Yeah. So essentially my question is, have you in your journey through meditation and mindfulness, have you paid much attention to the distinction between the dualistic style of practice, where one is a subject paying attention to an object, versus a non-dualistic style of practice where anything in one's conscious awareness becomes a potential object of meditation?
I think what you're alluding to is probably sort of different forms of meditation styles. The second probably will be more the sort of open awareness meditation, more perhaps along the Zen style, in comparison to the insight meditation, which always meditates on an object. I haven't really got that deep with regards to these different forms. I know that there's very different schools of meditation, and this is also where there's the dualism between the scientific approach to meditation versus the more spiritual tradition, sort of feeding, obviously, that discussion. And I have very much stuck to MBCT, mindfulness-based cognitive therapy models, which probably comes from the insight meditation tradition in a way that we meditate on an object. And I'm not saying it's the right or the wrong way of doing it. It's probably the only way I know. What I like about it is that if we sort of agree on a certain sort of curriculum of meditation practice that we use, it's easier to compare the intervention, and also to basically make them access to science in a way that we've done this type of meditation. We looked at pre and post measures, and we looked at how people did, and we can make it then accessible to actually what are the effects that we can measure. These debates are going on in the mindfulness community, sometimes quite fierce, but I haven't been part of it.
That's fair enough. So there's a clear, obviously, empirical benefit to keeping it as simple as possible, and we know enough about the benefits derived from this sort of straightforward dualistic practice. You mentioned before we started recording that you've been writing a book about mindfulness, and maybe you wanted to talk about that a bit.
It's always tricky to talk about a product that is nowhere near finished. I'm just sort of giving you a very brief sort of overview without sort of putting too much pressure on myself. But as you know, I've been delivering sort of mindfulness for doctors program for the last sort of 3 years or so, and I think you were part of the first pilot group. It's great to connect back to you on that, and out of which has sort of somewhat independently arisen also sort of an invitation to write something for doctors, and write something about mindfulness for doctors. And sort of over the time, my sort of practical work with doctors, and my sort of theoretical work of thinking about doctors and mindfulness has sort of merged into what I hope would be a book that comes out of this as my first book. So I'm sort of a bit shy about talking about it too much, because I still feel that it's nowhere near the finished product. But there are already books for doctors about mindfulness. There's lots of different ways of looking at it, so it's nothing completely new, I'm going to say. But every different individual needs a different way of understanding it. So psychologists are generally much more embracing about mindfulness as a concept than doctors have been. Doctors, as you said at the beginning, are perhaps more skeptical, and consider these kind of, I'd like to call it inverted commas, softer sort of approaches as something that doesn't really sort of interest them so much. They want to really sort of very change-orientated, sort of hard data and hard things, if possible, that actually work. So what I've tried, I don't know how successful I have been, but is obviously sort of giving doctors a way into making mindfulness something that's worth engaging with. It's not just something airy-fairy, tree-hugging, sort of esoteric. It's something that has got an evidence base to it. It's there's a big community of people out there. It works. And what I nowadays really think is also something that sort of supports us as doctors. Doctors have got a huge amount of sort of health needs, and how can we sort of look after our own emotional well-being as much as we look after our physical well-being? I think we're all good at thinking about, I need to go to the gym and I need to exercise, do my running, do my marathons, whatever people do.
I don't even think we're all good at doing that, to be honest. But probably
we're at least good at thinking about it. Yeah. We might feel guilty about it, but we're good at thinking and knowing that we should at least do it and drink less alcohol, and so we all should do this, but we don't necessarily have a should about our emotions. So I'm not doing to try to introduce another should, but perhaps sort of we can make our emotional well-being and our emotional regulating almost like another area of our lives that we can sort of start looking after more systematically, in a soft way, in a friendly way, but in a very systematic way. So we're really saying, Here's my body, here's my career, here's my house, here's my emotions that I look after. So that's the way I've sort of framed it for people. How can I keep myself as an emotional being well? And, we're dealing with so many emotions as doctors. We're dealing with everybody else's emotions. How can we look after our own?
Yeah, I think that's a very good point. And as doctors are just constantly engaging with the more tragic and unforgiving aspects of what life has to offer, to have that tool and that skill set is something that you can't emphasize enough. And I think that's a very excellent point to end on. I wish you the best of luck with your book. It's been a pleasure to have this conversation with you this morning, and I hope you stay safe throughout the rest of this crisis. Dr. Ruths, thank you very much.
You are listening to the Thinking Mind podcast.
If you enjoyed today's podcast, we'd love it if you share it with a friend, or you could give us a rating on Apple Podcasts, Spotify, or wherever you listen. If you fancy it, you can even buy us a coffee to support the team, and the links for that will be in the show notes. Thanks for listening.